The MMR vaccine contains a lot of aborted fetus debris and DNA particles.
That claim made by HHS Secretary Robert F. Kennedy Jr. right here on NewsNation has raised quite a few eyebrows, and now the administration's policy on measles is under the microscope. Kennedy was referring to the measles, mumps, and rubella vaccine. The rubella portion of the shot is produced from a fetal cell line originating from an abortion that took place in the 1960s. But the MMR vaccine does not contain the cells in its final form. North Dakota has become the 11th state to report a measles outbreak. The state confirming its first cases in 14 years. There are now measles cases in 30 states, but 11 official outbreaks, and more than 900 cases of the highly contagious virus nationwide.
Right now, measles is, I want to say, it's extremely contagious. And the biggest concern, the biggest worry that I have is when we get measles-associated encephalopathy or encephalitis. Encephalitis is when you have swelling of the brain, when the measles virus gets into the central nervous system.
For parents of kids who are not yet vaccinated against measles, this is raising fresh concerns, especially where there are outbreaks. Communities in West Texas, where MMR vaccine rates are low, are experiencing the worst of the outbreak. 2 children there have died.
I take care of older adults. And, the pneumonia vaccine, the flu vaccine in general, there's been so much misinformation out there about vaccines. So what I generally tell my patients is how a vaccine works. A lot of times people hesitate to get a vaccine because they don't understand what exactly a vaccine is doing. So I kind of try to break it down in simple terms, telling them that the vaccine is working by training their own immune system, which we all have, and who is fighting, bacteria and viruses every day. But the vaccine, what it does, it supercharges the immune system to readily and rapidly recognize a viral entity.
Of course, vaccines do not prevent someone from getting a virus. Rather, they empower the immune system to fight the virus to minimize the severity of symptoms and the length of illness. RFK Jr. has directed federal health agencies to explore other treatments outside of the MMR vaccine, such as vitamins and supplements.
The whole question about vitamins, the studies are very sparse. And these studies were from the 1980s. And they looked at people who were malnourished to begin with, who had low vitamin A levels, for example, in Africa and in certain parts of Asia. This is not necessarily the state in the United States. And also, vitamins have never been shown to prevent measles. They've only been able to help certain cases in children who are already vitamin A deficient. And we're talking about third world countries here.
Vitamins can boost someone's immune system, but decades of research has not led to any miracle treatment for the measles virus. I'm Kooiman. For more on the measles outbreak, you can head to our app, newsnationnow.com, or subscribe to us on YouTube.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.